Today we're going to discuss the ABCs of Medicare Supplements, or what's called Medigap plans. Be sure to stay to the end of the video for our free offer, so don't touch that dial. Hi, I'm Tim Hanbury, author of Medicare Blueprint. Original Medicare has some significant out-of-pocket costs, and in this video we're going to show you how to fill in the gaps in coverage with a Medicare supplement plan. So let's get started. First, you'll hear these plans called Medigap or Medicare Supplement plans. Actually, they're the same thing, and both names are used frequently. Medicare calls them Medigap plans, so we're going to use that term for the rest of the video. As the name implies, it fills in the gaps in coverage of Medicare. These plans are sold by private insurance companies, and the good news is that Medicare has standardized these plans to make them easier to compare. So, for example, a Plan G from ABC Insurance Company will have the same benefits as Plan G from XYZ Insurance Company. And there are 10 standardized plans, and unfortunately, they named them by letters as well. And this is where some people get confused about the different parts and plans of Medicare. The plans range from Plan A to Plan N. Now let's look at a comparison of the plans. The plans give you a choice of how much out-of-pocket you want to have. Plan F is the most popular plan since it covers 100% of the gaps in Medicare. It's also the most expensive plan. Another popular plan is Plan G. This plan covers all the same benefits as Plan F, except for the Part B deductible. And in most states, there are only 2 plans that cover 100% of excess charges, which we'll discuss in a minute. Plan N is also a popular plan. This plan covers the same benefits as Plan G, except after the Part B deductible, you'll have a $20 copayment for office visits and up to $50 copayment for emergency room visits. Except for the 8 states listed on the bottom of the screen, Plan N does not cover excess charges. So let's take a minute and explain what excess charges are. Medicare allows providers who don't accept Medicare as payment in full to bill you for the remaining balance. This is typically called balance billing. Unlike employer or individual insurance, Medicare puts a limit on how much they can balance bill. The cap is about 15% above the Medicare approved amount. That doesn't sound like a big cost for, say, an office visit, but what about a physician charge for an outpatient surgery or an ER visit? We routinely see ER visits that cost thousands of dollars, and that 15% can add up. Now, once you're 65 or older and first enrolled in Medicare Part B, you'll have a Medigap open enrollment period for 6 months. During this period, you can select any of the Medigap plans available, guaranteed from any insurance company in your area, and they cannot exclude any pre-existing conditions. If you have a special enrollment period, that is after the 6 months, which is typically the case if you stayed on an employer's plan with less than 20 full-time employees. When you come off that employer's plan, you can still sign up for a Medigap plan with no medical questions and no pre-existing condition exclusions, but you only have 2 months to sign up for a plan. And in this case, you'll be limited to the plans listed below. And as you can see, Plan G and Plan N are not available. You can still enroll in Plan G or Plan N, but you'll have to answer medical questions and can be declined or have pre-existing conditions excluded. And because of this, we recommend people that work for small employers to compare their Medicare coverage with their employer's plan. What we've found is Medicare with a Medigap plan can usually offer better coverage at a lower cost. Now, we've covered your open enrollment period and a special enrollment period. So what happens after that? Can you change to another insurance company? And the answer is yes, you can, but you'll have to answer medical questions. And if you have a severe medical condition, the insurance company can either exclude coverage with a pre-existing condition limitation for up to 6 months, or they can decline to cover you. And this is why it's so important to not just look at the monthly premiums, because you may only have one chance to pick a Medigap plan. You need to look at the financial ratings and their history of rate increases. And we have a software program that shows all this information. And in almost every case, the company with the lowest cost will end up costing you more down the road. They lure people in to buy with an initial low rate, and then they have big rate increases after the first year or two. Now, if you live in one of the 5 states on the bottom of the screen, you have an open enrollment period every year. And in this case, by all means, go to the lowest cost option. If they have a big rate increase or they give you bad service, you can just switch to another company the following year. So why do people choose Medigap plans? Well, first, you can go to any provider in the United States that accepts Medicare, which is the majority of physicians and hospitals. You'll have the freedom to go to any of these providers that you want and not be restricted by a network. Insurance companies also don't manage the care you receive. If Medicare approves the claim, then the insurance company pays their portion based on the plan you have. So if Medicare pays, the insurance company pays. You also have a wide choice of plans, so you can choose the coverage and the out-of-pocket that you're comfortable with. Plus, since the plan designs are standardized, you don't have to worry about changing every year. These plans automatically renew as long as you pay the premium. Now, Medicare does have a change starting in 2020. Plan F will no longer be offered to people turning 65 after January 1st of 2020. Anyone currently on a Plan F will be able to keep it and change to another insurance company offering Plan F as long as they medically qualify. Some additional reasons why people choose a Medigap plan is that they cover an additional 365 days in the hospital after you've exhausted all your Medicare reserve days. All plans also cover 100% of the copayment that Medicare Part A has. They provide coverage for your skilled nursing care, and 6 of the plans have foreign travel coverage. 3 of the plans also cover excess charges that we discussed earlier. And as you can see, Medigap plans can offer tremendous coverage with very little out-of-pocket cost to you. In addition, you can go to any doctor or hospital in the United States that accepts Medicare. If you have any questions, please comment and we'll reply or cover your question in an upcoming video. If you'd like to stay informed on everything Medicare, please subscribe to our channel. Thanks for watching the video, and as promised, click on the link in the description to get your free offer.